It is clear that some areas are weathering this pandemic far better than others, both inside and outside of the United States. And joining us now to discuss this and see what lessons we can learn from the different approaches that we're seeing used around the globe, the former White House Senior Director, Nahira Haq. Welcome back to the Damage Report.
Good to be with you guys again.
Yeah, great to have you here. I wanted to start off with your home state. So you're originally from Maryland, correct?
Well, I grew up in New York, which is a whole different story right now.
That's true.
But I've been lucky enough to live in Maryland for the last several years, where there's a Republican governor who is not very Trumpy. And so he's done something very interesting. I think he got an idea and saw where this was going early enough that he just reached out to South Korea directly. His wife has some business contacts there, and she negotiated. The First Lady of Maryland negotiated 500,000 test kits to be sent directly to the state of Maryland. And so that's the initiative he's had to take, because the federal government has completely failed under the Trump administration to provide any testing or tracing for victims of the coronavirus.
Well, and since that deal came out, Trump has sort of implied that it wasn't necessary, that he could have just gotten the help from Mike Pence. All these governors keep saying that they need help. Trump says they need to do it themselves. Then you have this case where one goes and does it himself. And now he's like petulant, like he's like angry that it makes him look bad that a U.S. governor would have to go to South Korea. But it seems like a great move.
Right, that's the position he's put every governor in. He's made every state fight for resources. They've had to negotiate with companies independently, and so they're outbidding each other for everything from testing to PPE, with now suddenly the federal government as a weird competitor in all of this as well, when the normal situation would be the federal government using its defense authorities, to wartime authorities, essentially, to talk to the companies and say, here's what we need, here's how we're going to distribute it, we need you to do X, Y, and Z. So everybody's out there for themselves. I'm like I said, I'm glad that I live in a state where the governor realizes that there's a problem, versus, a couple of states further down in the South, Georgia, which is like, hey, let's start getting our hair cut tomorrow, right? Let's go to the movies again. We have similar to New York's lockdown situation here. People are abiding by the rules, but cases are still rising. So this is going to be a problem for quite some time. And the federal government is just not stepping up to the plate. The thing that really infuriated me, I think, was hearing how Jared Kushner, who has no skill set in management or any type of emergency response or science in general, stating that this is this federal government, all of the supplies that we have in the national stockpile, they belong to us. I'm like, who's the us that you're talking about if it's not the people who are living in the states?
Yeah. So I'm curious, like that they were able to manage this deal with South Korea to get the 500,000 tests, which at least implies that South Korea now has more tests than they need. Do we know how South Korea is doing? I know that initially they were pretty hard hit in the early days of this. Are they recovering better than other countries?
So South Korea never officially went into lockdown. Throughout this entire corona situation in South Korea, if you've been living in, say, Seoul, you've been able to go about your day to day, because here's what they did. First of all, they had a preparation challenge that they addressed up front. They were very close to the SARS cases in China. So they kind of prepared in advance and realized that this respiratory pandemic is a huge possibility. Now, we knew about this in the United States and had tabletop exercises as well, but we were a little bit removed from it. So the reality didn't sink in the way it had for South Korea. They also, early on, as soon as this broke in China, they loosened the regulatory system for developing testing kits. And so they were able to have as many as they needed. And then they also loosened by legislature. So this is controversial, I think, in a United States context, but their legislature allowed for government to get access to people's phone records and to medical records and bank records so they could do tracing. So this, in South Korea, it started with one church where, get this, is there's just 200,000 member church. And as part of their services, they have to kneel on the floor, sit in front of each other's faces, and bless each other. So they're like face to face.
Oh, geez.
That's how it broke out in South Korea. But they managed to trace and test almost all 200,000 members of this church and isolate them, put them under individual quarantine, and ride this out essentially in a way that we haven't seen. They still have baseball games there. right? People are still going out and about, but they did give up, in the near term, they gave up some individual liberties that I think would be challenging in an American context, but their life is moving on for them and their economy is open. They're not struggling with this in a way we are. I will say this, though. Part of what also worked to their advantage, in addition to preparation and government intervention, is the fact that half of the population lives in Seoul. So it is not like 50 states with all these rural communities sprawled out. It makes policy response and government intervention much easier to engage.
Yeah, and that's fascinating. I'm curious. We were talking before the show about some other countries that have managed to do pretty well so far, and although our administration, which has struggled mightily with this, struggled in that the outcome so far has been bad, not struggled as in working hard to overcome it, had criticized countries in Africa with colorful language in the past years. Some of them appear to be doing pretty well, right, so far during this pandemic?
Very much so. Again, the United States is surpassed a number of deaths and cases compared to every other country, and that includes all these African countries that Trump liked to denigrate in the past, and cut off immigration from several of them because he's convinced that all they offer is harm to the world. When in fact, if you look at Ghana, they're ready to reopen their economy as well. They have a community that is pretty much hand to mouth, right? Like if you grow certain types of like a groundnut, you have to get it to market right away. So they instilled a very strict quarantine early on. People complied. But when I mean strict, I mean they had law enforcement checkpoints at the corners, making sure that you had to either show a paper for why you were out and about, or you're going to get thrown in jail. So they went the more authoritarian route, and that way people complied. And Ghana is a longstanding democracy. I think there's challenges for other countries where there are more nascent democracies and whether or not authoritarianism creeps in under the guise of the pandemic. But I wanted to mention Senegal, which is they have a large expatriate community from Europe. They have a lot of NGOs based out of there, and so they did not have to do these crazy authoritarian measures. They had testing available, European tests available early on. Similar, they're opening up their economy, they're able to engage, but it's also they have compliance rates with this, right? You don't see protests against the government trying to help people in a medical or pandemic situation. People genuinely feel the fragility of the healthcare system there, right? Because they don't have access to vaccines the way we do. Like malaria, it still kills millions of people throughout the continent. And so there's a sense there's no anti-vax movement in Africa either, right? There's a sense there that being closer to healthcare fragility helps them appreciate that when a government says we need to work together and band together to keep us all safe and healthy, people comply. They understand this. There's no arrogance or privilege involved with, I need to go get my roots done, so, let me go march on the state capitol.
Yeah. No, so I'm so glad that you can provide those little bits of optimism from these other examples. Hopefully we can learn from a bit of it. Some of the lessons, I guess, seem pretty obvious. You should test people.
Check out the Damage Report podcast each day, wherever you get your podcasts, whether Pocket Casts or Stitcher or iTunes. You can join me as I give you the news and stories you want, with a range of co-hosts and interview guests jumping in on the fun each day. Again, that's the Damage Report, wherever you get your podcasts. And if you get them at iTunes, don't forget to rate and review. Sometimes I'll read them live on the show.